honourable member for Calgary Edgemont has a question.
This government has blocked universal access to prescription contraception 3 times in the span of a year. For a person paying for birth control, this is $600 that they could have saved this year if the UCP had just stepped up and done the wrong thing. I know that Albertans overwhelmingly support pharmacare. It is essential health care, and it's long overdue. This government wants to disadvantage women. Is it not the government's responsibility to support all Albertans?
The Honourable Minister of Health.
Mr. Speaker, we want to make sure that Alberta gets its fair share and that we get a good deal. Mr. Speaker, we're not alone in that. In fact, Alberta's Pharmacists Association today, in the response to the National Pharmacare Plan announcement, said, and I quote, "The Alberta Pharmacists Association believes that pharmacare funding should be transferred directly to the province to ensure alignment with existing programs, improve access, and provide coverage to those Albertans in need. There's little to no direct engagement with pharmacists who play a primary role in administering and coordinating drug plans."
The honourable member for Calgary Edgemont.
Given British Columbia already has universal access to contraception, and Manitoba announced that they intend to do this too, and given that almost 180,000 people have received free prescription contraception since BC offered it in April, where is the advantage to young people that be able to get free birth control everywhere else in this country except for Alberta?
The Honourable Minister of Health.
Mr. Speaker, I think the member opposite doesn't know that our plans already cover 50 oral contraceptives, intrauterine devices, and emergency contraceptives covered in our...
The Honourable Minister.
Mr. Speaker, the member opposite should become informed about what our plans actually do cover. In our pharmacare plan here in Alberta, Mr. Speaker, we provide over 5,000 drugs, including diabetes medication, including birth control and contraceptives. Mr. Speaker, we have a great plan. If the feds want to opt in, they can give us more money to it.
The order, the honourable member.
Given that the UCP seems to think that birth control is a luxury item, while we are experiencing a cost of living crisis, and given that the rest of the country has said loud and clear prescription contraception should be free, and given that Albertans who use birth control are currently paying more than $10,000 over their lifetime out of their pockets for contraceptive products, why is the minister refusing life-changing measures like a contraceptive pharmacare plan that would take an immense financial burden off the shoulders of Albertan women?
The Honourable Minister of Health.
Mr. Speaker, again, the member opposites are trying to make, lemonade out of lemons here. This is a bad plan in the sense that the federal government is not acknowledging our current plans. We already have a pharmacare program, Mr. Speaker.
Order, 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 order. I had no problem hearing the question, but I am having a hard time hearing the answer. The minister is entitled to give it. The Honourable Minister of Health.
Mr. Speaker, even the Canadian Chambers of Commerce has issued a statement saying that a single-payer pharmacare program would actually leave many Canadians worse off. A majority of Canadians are already covered by employer-sponsored drug insurance plans that give them faster access to more medicines than what a single-payer system would provide. Plus, Mr. Speaker, public systems typically offer less access to new drugs.
The honourable member for Lacombe-Panoka has a